It's morning cold, believe that.
Billy Couch didn't think much about COVID till he got it.
Don't mess around, because this ain't a joke. This is not fun and games. I've been here so long, I want to go home, but I can't go home because I can't breathe still with it. This is not a game at all. When you're sitting there and you can't breathe and you feel like you're going to die.
In the hospital, 19 days now, the unvaccinated 42-year-old isn't sure how he picked up the virus. He toughed it out at home for 8 days before being admitted.
How serious is COVID?
It's bad to the bone. I recommend everybody wash their hands, do what they got to do. Stay home, stay social distance, because it's bad. Trust me, it's bad.
Until you had it, did you think it was bad?
No.
What'd you think it was?
I didn't pay no attention, to be honest, but I do now. And get your shots.
Wanda Combs manages the nursing staff in the COVID ICU at Appalachian Regional Healthcare's largest facility in Hazard, Kentucky. A nurse for 30 years, the job never tougher.
It's been very, very hard. And I get emotional because it is our community. ICU nurses work very hard. They work very hard every day. But you can usually see a difference. So you work hard and you see a difference, and that's okay. You don't care that you're tired. You've made a difference. So with this, they still work just as harder, and it really hurts when you don't see a difference.
Just when they thought they were through the worst of the pandemic, it's come roaring back. Patients younger, sicker, harder to treat.
The family, it's hard for them to realize, oh, you mean this is the end? Do you really mean this is the end? It is our community. It's people that we know people they're related to, so that's what's really hard on the nurses, is the emotional part too.
In the COVID ICU here in Hazard, every bed taken by those suffering from severe cases of COVID-19. Every patient intubated except for one.
What is this virus doing to places like Hazard, Kentucky?
It's destroying us. Yeah. Everybody's getting it. Everybody's getting sick. Everybody's, I don't know. We're just seeing a lot right now.
Appalachian Regional Healthcare has 13 facilities across eastern Kentucky and West Virginia. Its entire system now overwhelmed by COVID.
We have no ICU beds available, zero.
Zero. 13 facilities.
Across 13 facilities, we have 0 ICU beds available. We have 35 patients waiting in our ERs for beds.
Today, Appalachian Regional Healthcare has three regular beds available across its entire system. They've cleared space and made room for 200 beds that sit empty, unable to staff them.
We have applied for FEMA disaster medical teams at multiple of our hospitals. Our understanding is right now that Louisiana is in dire need, and so most of their teams are there. So we are on the list, and once they have availability, we hope that we'll be able to get support.
The hospital system needs 170 nurses today to open up extra beds. Nurses now working longer hours and doubling up on patients just to keep up.
One respiratory therapist should comfortably have 4 ventilator patients, because we work with the nurses as well. But right now I have about 7 to 8 ventilators per respiratory therapist.
Here in Hazard, patients are coming in younger and sicker than nurses have ever seen.
We're seeing much younger patients now than we did before. So we're seeing, I have patients from 20 years old today up to 75 years old. So it attacks everyone. It's not just limited to one age group.
This year, it doesn't matter. I've had several patients under 20 years old.
Under 20?
Mm-hmm.
How sick?
Very sick, actually, for their age.